the chat or take yourself off mute. And Ning, my partner, will ask this question.
Thanks, Martha. Hi, everybody. I guess it's not morning anymore. Good afternoon to everyone, barely by 2 minutes. So our first test your knowledge question is, so the best way to protect yourself against West Nile virus is avoiding mosquito bites. What do you think are the 4 Ds of mosquito prevention? You can put your answer in the chat or you can unmute yourself. We have some typers, so I'm going to wait. Good. Yeah, awesome. So you all work together. There's 4 of them. So the 4 are, and Martha will go to the next slide. Defend, dress, drain, and dusk and dawn. Dusk and dawn are grouped together. And we'll go over these a little bit more towards the end of our slides here. But this is just kind of an overview of what they are. And I'll chat about them more when we go over West Nile later.
Wonderful. And our second test your knowledge question is talking about health inspections. So what do you think during the ECE health inspections in the state of Colorado in 2023? So this is the whole state, not just Boulder County. What do you think was the most common critical violation? A, personal hygiene, B, hand washing, C, sanitizer, and D, medication first aid. Awesome. Thank you. Keep putting some answers in the chat. Thank you so much. We have hand washing, hand washing. I see some typing, so I'll just wait. A, which is personal hygiene, and B, hand washing. And interestingly enough, the answer is C, sanitizers. So we'll be discussing that more later as well. And I want you just to be thinking, why do you think sanitizers were the most common critical violation? So here you can see this is some data from CDPHE, which shows common violation data between January 1st, 2023 through December 31st, 2023. And the highest column here is sanitizers at 37%. So taking a step back, Ning and I and our whole team at Child Health Promotion just want to thank you all for doing such a great job in helping to keep our children healthy. You are the hands and feet that do all the wonderful care for our children. We know you are all working hard, and we're excited to continue to partner with you. So who answers your health and outbreak questions? If you write to the Health ECE at bouldercounty.gov, I, Martha Hensa, answer your questions as well as Ning Chan, who's assisting me with the call today. Today, we're going to be talking about August as National Immunization Awareness Month. We'll focus on sanitizers, how to keep your children safe and healthy. And then Ning will take it away with communicable disease updates. We'll be talking about highly pathogenic avian influenza, HPAI, COVID-19, and West Nile virus. And then we'll hear updates from our partners, Amy at ECCBC and Jody at CCAP, and then a summary and future meetings. So to begin with, August is National Immunization Month. And if you go to the CDC website, which is where I found these logos and posters in Spanish and English, this is their current poster just encouraging people to stay up to date with the recommended vaccines. So what does this mean for you? Check your immunization schedules and certificates for those who are previously enrolled, as well as new enrollments for this year. Have your designated ECE facility health authority review and remember to sign the immunization certificates to make sure they're up to date. And then the following vaccines are required for a child to attend a Colorado licensed child care program unless an exemption is on file. And Sining will put in the chat the latest CDPHE immunization resources. Thank you, Sining. And here at Boulder County, we have 2 different clinics, which you can encourage your families and children to go to. So the Boulder Clinic, and there's a Longmont Clinic. And we also have these trifolds, which our immunization department has created for us, if you would want to download some of these to share with your families in English and in Spanish. And then this, if you click on the Boulder County Immunization Clinic appointments, I just wanted to show how easy it is to make an appointment in Boulder. And the Boulder Clinic is open on Wednesdays from 1 to 4:30. And the Longmont Clinic is open on Mondays from 2 to 7 p.m. And you can just click and make an appointment. And appointments are recommended, but walk-ins are also welcome. And thank you, Sining, for putting those in the chat. Okay, now let's do this deep dive into sanitization. So we learned what were the most common critical violations.
Hey, Martha.
Uh-huh.
Can I interrupt you real quick?
Oh, please.
I just, maybe you mentioned this, but I don't think I saw it. The immunization clinics are available. Is that for everyone or just children who qualify with certain income?
It's based on income.
Okay. I just want to
Yeah,
make sure
thank
everyone
you.
knows that that's not just anyone can walk in. So there's information on the website and in the flyer about who qualifies. Okay, thank you.
Yeah, thank you so much, Kyla. Good point. I like our child health promotion team. We're really a team. Thank you, Kyla. Okay, so back into sanitization. So we looked at what were the most common critical violations in 2023. And so far, I was just at a CDPHE talk last week, and they had the data already available for what was the most common critical violations so far in 2024. So from January to July. So what do you think was the most common critical violation so far in 2024? You can put it in the chat or take yourself off mute. First aid kits, missing stuff. That's an important one. Interestingly enough, it's again 37%. So this is July 1st. This is, July 1st, 2023 to June 30th, 2024. So again, it's sanitization, 37%. So the state is asking us, how can we improve this? And what do you think are the most common reasons that sanitizers are written up as a violation? And again, please put your answers in the chat or take yourself off mute. Not strong enough? Yeah, excellent. So making sure to use the test strips to make sure that the bleach solution is 50 to 200 parts per milliliter. So not strong enough is an important one. Thankfully, CDPHE has created a new child care guide to successful inspections. And Sining will put this guide in the chat so you can look at it. It's a 2-page document, and our goal is that you are successful. And I focus specifically on the section that talked about sanitizers. And so, you know, some of you will be having inspections coming up soon. And so the 4 top things to look at is look to make sure that the bottles are properly labeled with intended use, correct concentration, and make sure you have test strips available for testing, knowledge of which surfaces should be sanitized versus disinfected, as well as the frequency of sanitation. So going to properly labeled, there should be 3 steps. Step 1, wash. with soap and water. Step 2, rinse with water. And step 3, sanitize. And we have these labels available for you. So when we come and do the inspections, we'll bring them. And please don't forget to ask Kara and I and Kyla when we come that you would like these labels. And it's especially important to label and to put the name of the sanitizer that you're using. Maybe it's bleach and water, but if someone got it in their eye or something, it's important to know exactly what is in that bottle. The second thing is the correct concentration, which somebody had put in this chat. Thank you so much. So if you mix your own, is the bleach solution too high or too low? And making sure that you have test strips available to test. Often when I do inspections, I'll ask people, so show me your typical routine after you mix your bleach. And people will pull out their test strips and spray it with their spray bottle that has sanitizer with bleach in it. And then we'll look at it and see if it's between this 50 to 200 mark. I was at a facility a couple weeks ago and they pulled out test strips, but they were for their personal hot tub that they had at home. So just make sure that you're choosing the correct test strips to test your bleach solution. And Jane just said in the chat, if you're purchasing pre-mixed sanitizer, you don't have to test it, only if you're mixing. Good point. And you should test the sanitizing solution every day. And if it's not between 50 and 200 parts per million, it needs to be discarded and remade. I was at one facility and it tested 200. And so we needed to, it tested very, very black, over 200. So we needed to correct it. And so we poured out all of the water in the bleach container and only added water. And then it went down to 100. So you can see how little bleach you need to use to get it between that 50 to 200 parts per million. And greater than 200 parts per million is used for disinfecting. And then as Jane was alluding to, there are many approved ready-to-use sanitizers. I've seen many facilities use this Purell food service sanitizer, which has no rinse. And this is just one example of an approved ready-to-use sanitizer. It's not exhaustive, it's not an endorsement, it's just an example. Okay, let's go on to what surfaces should be sanitized. Do you use a mnemonic device when you teach staff about what you should use your sanitizer on versus what you should use your disinfectant? I'd be curious to learn what you use with your staff as a quick and easy way to remember what should be sanitized, what should be disinfected. I'll pause for a moment. When I first started working with ECEs, I was having a hard time remembering what's sanitized and what's disinfected. And sanitize are the 3 T's, so tables, toys, and touch surfaces. And then disinfecting is D and D, disinfecting diapers, which would then include all high hazard body fluids. So vomit, feces, and blood. So do use your household bleach with instructions for the food contact surface sanitizer, use on tables, toys, and common touch surfaces, and make sure you watch with soap and water, followed by rinsing before sanitizing, because the sanitizing solution is not as effective if it has any of the dirt or grime still on the surface. And then you do not want to use a sanitizer. You're not allowed to use any that are scented or splashless or low splash bleach. And you do not want to use the sanitizer on diaper tables or surfaces contaminated with high hazard body fluids. And make sure, again, the 3-step process that the surface is cleaned with soap and then rinsed with water so it's as effective as possible. Okay, how often should you sanitize? So food contact surfaces before each use, tables and chairs before meals and snacks, toys. So the next two categories are differentiating toys for infants and toddlers versus toys for preschool and older children. So infants and toddlers need to be cleaned after placed in a child's mouth and daily, and preschool and older children are after placed in a child's mouth and weekly. And then bedding, including nap mats, should be sanitized weekly and when contaminated. And then soft toys should be sanitized weekly and when contaminated. Now, Sining will take it away with the communicable disease updates.
Yeah, thanks, Martha. Hi again, everyone. My slides are not quite as interactive as Martha's are, but I'll be going over some, I think, fun communicable disease updates with you all. All right, and our first update section is about HPAI, or highly pathogenic avian influenza updates. I think we had a question about this on our last call, so we did put together some slides, and that's just a good example too. If you put some questions in or let us know what you're interested in learning about, we can always put together some slides for you in our next.
You know what, Sining? I can't hear you all of a sudden, but maybe it's just me. Oh, now I can.
Okay. Can everyone else hear me okay?
Yes, I can hear you. Thanks.
Okay, perfect. Awesome. All right. Next slide. Thanks, Martha. All right, so what is HPAI? So many of you might know HPAI as the bird flu, and that's because the two subtypes, H5 and H7 of the type A influenza viruses mainly do infect birds. That does include poultry and other wild birds as well. Typically, HPAI is transmitted from bird to bird through contact with saliva, nasal secretions, feces, stuff like that. It is highly contagious among birds and also deadly for them. You might have seen back in a couple years ago when we were seeing egg prices get hiked up pretty quickly. That was largely in part due to HPAI spreading in our poultry flocks. And kind of going off of that, I thought I'd give you a timeline of HPAI in the US. I know that recently we've seen a lot of HPAI information in the news, but I just kind of wanted to give you context for how long we've actually been monitoring this situation. So, like I said, in January 2022, USDA began monitoring H5N1 infection in wild birds, which quickly in February of 2022 moved over to commercial poultry facilities. That was kind of when all of those culling operations were happening. So basically when one chicken in a flock is identified, they do have to cull the rest of the flock. So that results in, like I said, those egg prices getting hiked up, and then lots of big culling processes that were happening throughout the United States. And then in April of 2022, we did see our first human case of H5N1 in the US and also in Colorado. So Colorado had the first case of H5N1. Really, really mild symptoms, and we didn't see other humans typically get infected after contact with H5N1 poultry. Through May of 2022 to December of 2023 is when we saw H5N1 move over into other mammals. So that included a fox, lynx, bears. There were dolphins that we were able to detect H5N1 in. And mainly it was because of these animals tend to be predators of birds or poultry. And so that was how they thought it moved over into those animals. And then this year, in March of 2024, we did see H5N1 reported for the first time in dairy cows. We're not really certain how it moved over to dairy cows at this moment. They're still kind of doing research and whatnot on that and collecting more epidemiological data. However, a lot of poultry farms are not far from, dairy herds. I believe they're called dairy herds. And so there might have been some crossover and stuff like that. And then in April 2024, we saw our first case of cow to human spread identified. So that is kind of when things started picking up in the media and when people started hearing more about H5N1. And then recently in the last month, we've seen quite a bit more activity in the H5N1 world. Yeah, perfect. Okay. And then I have here some more recent updates. So specifically in Boulder County, and then in Colorado, and then dairies as well. I have a question. Is this a worldwide situation? It is. So they have been seeing H5N1 in poultry in many other countries. I'm not exactly sure how many there are. I know that it was happening in the UK as well. I don't believe that they've found H5N1 in dairy cows in other countries yet. I believe that's just in the US so far, but they have had other human cases as well. I know that there was a human case in Mexico like a few months ago, and stuff like that. Not as familiar with what's going on in other countries, but that is a great question, and I'm happy if you have any more specific questions to answer them. If you want to send me an email, or yeah, you can always reach out to healthece@bouldercounty.gov. So yeah, as of our most recent numbers are from last Thursday. Typically numbers on the websites are updated on Tuesdays and Thursdays at 4 p.m. So that's what we have as of now. So these numbers could change tomorrow. But they actually, I think at this point, have kind of plateaued. But as of now, we have had no positive humans or dairies in Boulder County. Boulder doesn't really have huge dairy herds. Most of our dairy farms are more like small. We have a lot of goat farms and stuff like that. So less impact that we're seeing in Boulder County. And then obviously because of that, we don't have a lot of people that work closely with H5N1 infected flocks and herds. But as for H5N1 in humans, we have had 10 human cases in Colorado. To give you some perspective, we've had 14 cases in the US. So 10 out of the 14 cases in the US have been in Colorado. All of these cases have had exposure to either poultry or dairy cows that have detected H5N1. So it's not like they are general public members, and most of these individuals are actually involved in the culling processes. So when they are killing these large flocks, so they have a lot of contact with these birds and dairies. As far as H5N1 in dairy cows, we have had 63 positive dairy herds in Colorado. They're all in the Northeast region, so predominantly Weld County, and that number is increasing pretty much, weekly. There's a lot of crossover between dairy herds. There's cattle that is moving between them, and so that we think that's kind of contributing to that happening. They have found H5N1 in raw milk specifically, not pasteurized milk. So if you are only drinking pasteurized milk, you should not have any exposure to H5N1. And as always, public health doesn't recommend consuming raw milk anyway. And then in the US, there's been 189 dairy herds, and I believe that's among 3 states, and I'm not exactly sure which states those are. But I have linked some resources here at the bottom that we'll share these slides with you when we get this recording out. But CDA, CDPHE, and CDC are all putting out numbers in regards to the H5N1 situation, and those are getting updated quite frequently. And then here's the screenshot on our right. I just wanted to give you an idea of what's going on in terms of H5N1 in Boulder County specifically. We haven't detected any animals with H5N1 since December of 2023, so it's been pretty quiet in Boulder County, and most of these are among wild animals. So not typically animals that you would have a lot of exposure to, or your children and your ECEs as well. Next slide. And then I guess this is the question that everyone is probably most interested in, is what is the public health risk? Currently, the risk to the general public remains very, very low. Like I said, all of our identified human cases have had some known contact with an H5N1 infected animal. There's been no recorded person-to-person spread, so that means that one person hasn't been seen to give it to another person, household contacts or anything like that. And then finally, we have had no hospitalized cases. So all of the cases that we have identified have had really mild symptoms, just conjunctivitis and fatigue. And I know that you see both of those in your ECEs a lot, but it's unlikely that if a a child comes down with conjunctivitis and fatigue without any known contact with the H5N1 infected poultry or dairy cow, that they would have H5N1 as well. All right, and you guys can continue to drop questions in the chat if you have any H5N1 related questions. I can keep an eye on that. We can always jump back to those slides. As far as COVID-19 updates and reminders, I know that COVID-19 is kind of increasing again in facilities. It's kind of happening, and I'll go over this in I think in the next slide. But we are seeing increases among the community as well. So we just kind of wanted to touch on guidance and whatnot, so that we can kind of alleviate questions that come up as you all continue to see COVID in your facilities. So the current epi of COVID-19 looks like this graph on your right. What we're using right now mainly is wastewater facilities and wastewater samples to identify what COVID circulation looks like in our community. As of right now, our highest variants are KP311, KP3, and LB1. Those things mean pretty much nothing to, I think, most of us, including myself. Basically, these are all Omicron variants. So Omicron is the variant that popped up, I believe, in 2022, maybe 2021, when we saw that huge spike in the winter of that year. All of these are Omicron variants, and none of them are resulting in increased severity or transmissibility. So we're not seeing increased hospitalizations. We're not necessarily seeing that it causes more infection. Like each person who's sick with COVID doesn't infect, more than your standard number of people that we've been seeing in the past. What's different is that we are starting to see an increase in the summer, which is interesting. I think typically we see COVID increase in the respiratory season, and that might be because people just expect there to be coughing and sneezing at that point, so they're just unconcerned with COVID, which causes less testing and less diagnosis, which leads to more transmission. But we are seeing levels increase. Wastewater is showing us that, but we're not seeing, like I said, hospitalizations or deaths increase. What's most important is the CDC is recommending that everyone ages 6 months and older receive an updated 2024-25 COVID-19 vaccine. We're not exactly sure when those vaccines will be available yet. I've seen kind of differing sources saying different things, but all I know is that it will be released later this year, and there will be Moderna, Novavax, and Pfizer vaccines available. I'm sure that once that information gets released, it will be released in the press, so kind of keep your eyes out and your ears out for it, and maybe it'll be around the time we have our next meeting, but hopefully before that. And then our COVID-19 guidance. So the biggest thing that we wanted to remind you of is that there aren't any updates for 2024-25 school year. So we haven't had any changing in guidance for COVID. As of right now, we're treating it the same as other respiratory illnesses like RSV and flu. We just say 24 hours once you have recovered from illness and you're not taking fever-reducing medication. So that information is all in How Sick is Too Sick. So remember to keep that on hand. And then I see in the chat there, any more free COVID tests? As of right now, the state is not providing free COVID tests, ECEs. I believe that they still have that bulk, I forget what it's called. It's a bulk pricing agreement, I believe. And so if your facility wants to buy bulk COVID tests, they certainly can, and it's at a reduced price. I'm not sure if if multiple ECEs were to get together and want to buy them together, that might be an option as well. Yeah, and then I think this one is for Jenny has a question, I think for Martha about sanitizing. Martha, you can either type in the chat or you can answer it now. I'm open to whatever.
You know what, could you send me a picture of the BioS disinfectant that you're using, Jenny? And I will look that one up. I need to find out what the active ingredient is in it. That's a great question.
And,
Go ahead.
Can you give us your email again in the chat, maybe? I forgot to write it all down, and especially how to get those labels that you talked about earlier too.
Yes, I'd be happy to.
Thank you.
Thanks, Jenny.
Yeah, and Carla said that they purchased in bulk last year the COVID test, and it's a great deal. Yeah, so we can. I believe we still have. I do at least. I have a PDF with that information. If you want to reach out to the Health ECE email, and I can send that over to you. Yeah. And then finally, we just wanted to remind you all that, of course, COVID-19 clusters and or outbreaks should be reported to public health. I know that as we all know, COVID-19 is circulating. So we're typically saying anything above baseline or causing more severe illness. So if you're having hospitalizations or if you're seeing increased transmission, or sometimes like we like to know about situations that might be event-based. So if you took all of your students or your children out to like a field trip or something like that and they all got sick afterwards, that might be something we'd want to know about. So I think at the end of the day, we'd rather know than not know. So if there's anything that you're not sure about, you can always give us an email and then we can chat about it and see how we want to proceed from there. And also just a reminder that it's not just COVID-19 clusters and outbreaks that we want to be reported, but pretty much any other kinds of illness clusters. So if you're seeing clusters of vomiting, clusters of rash, stuff like that, that's something that we would also like to know about as well. Okay. And then I have some updates on West Nile virus. I know that this isn't necessarily something that affects the children that you work specifically or your community, but it's just something to keep your eye on as we're going into West Nile season. And I know that you all go outside a lot with your kids. So yeah, we're going to talk about that a little bit as well. Okay, so what is West Nile virus? So this virus is transmitted through the bite of a mosquito. It's actually the leading mosquito-borne disease in the US. Most people, I think it's about 80% of people that are infected with West Nile virus actually don't exhibit any symptoms. So most people won't have symptoms or just have really mild symptoms like maybe a fever or like cold-like symptoms. But people over 60 years of age and people who have medical conditions and are more susceptible to severe illness can develop pretty severe illness. And unfortunately, there's not a vaccine available right now for it, and there's really not treatment for West Nile. What they do is they just treat either the condition that it caused or they treat the symptoms. But it can cause inflammation in the brain and or spinal cord. You might hear know that as meningitis. And really the people that develop severe illness, about 10% of those people can die from it. West Nile virus in Colorado is especially exciting. In Colorado, it was introduced in 2003, so it's a somewhat new disease for people that are working in infectious disease. 20 years is not that long. Typically, cases show up anywhere between June and September. This really depends on the weather because of mosquito breeding and stuff like that. But these numbers typically peak in August. Colorado cases account for 26% of all of the cases in the United States. Just to give you some perspective, Colorado population only accounts for about 1.6% of the US population. So that's a lot of the cases in the US. I think a lot of that has to do with like environmental factors. We have a lot more people that spend time outside in the wilderness, right? Also, we have bodies of water that they can breed in. And then, of course, we have mosquitoes that carry West Nile virus, which also helps in transmitting it. 2023 was our worst year since the introduction of it, and about 60% of our cases had neuroinvasive disease. That high number of 60% is likely more due to the fact that the only people that are testing for West Nile virus are people that have severe symptoms. Like I said before, people can usually 80% of people only have no symptoms or mild symptoms, and typically you're not going to test for West Nile if you just have cold-like symptoms. So that number looks kind of scary high, but really, otherwise, we're identifying West Nile virus cases through maybe like blood testing or people that are donating blood or something like that, or donating organs. That you're okay.
Sorry.
That high number is likely due to a wet spring season that we had last year. Last year we had a lot of rain, and this year we really haven't had a lot. So you'll see that kind of impact our numbers this season as well. But for context, we had 634 cases of West Nile reported in Colorado with 51 deaths, and Boulder County last year only had 29 cases. Like I said, West Nile and Boulder County this year, we have had a dry spring and summer, which as of right now means that we have had no cases of West Nile virus in Boulder County. I think our last report, we've only had 7 cases reported in Colorado this year. So our numbers are quite low. As I said earlier, typically numbers peak in August. And so either we're seeing a later season or really just, a low season generally because we haven't had a lot of positive mosquito pools. And then this last bullet here, just so the way that we monitor West Nile in Colorado and try and predict how many cases we're going to have is we look at mosquito pools and they test the mosquitoes in these pools and test them for West Nile. So last week, we only recorded 3 positive West Nile virus pools, which is pretty low. And I'll have Martha share. Boulder County does release a report every week that kind of tells you what's going on in terms of what kind of mosquitoes we're seeing in Boulder County, and then how many pools are testing positive for West Nile as well. And then I think this is my last slide, but this kind of goes along with our test your knowledge question from the beginning of our presentation. But I just wanted to go over the 4 Ds because these are the best ways that people in the general public can protect themselves from West Nile virus. So the first one is defend, as someone had mentioned earlier. So defend means you're going to wear an EPA approved repellent. So that can be DEET, which I know that some people don't like to use because it smells bad, potential worrying about health effects and stuff like that. But oil of lemon eucalyptus has also been shown to be pretty effective against mosquitoes as well. I believe that thank you, Martha. Martha shared the EPA approved repellents as well. And then we talked about this last time on our last presentation, but you do need parental permission for these repellents. So just a reminder to get parental permission. If you have questions specifically about that, you can send us an email and we can share the slides with you from last time in the notes. The other thing you can do is you can dress appropriately. So make sure you're wearing closed-toed shoes, you're wearing light colors. Mosquitoes tend to be attracted to darker colored clothing. And then making sure you're wearing long, loose sleeves and pants. So even if you're wearing long pants that are tight, the mosquitoes can still bite you through those pants. And so we always recommend wearing loose clothing in order to protect yourself. Another thing that you can do is you can drain out any empty tools or objects that tend to collect water that might be outside of your facility or even in your homes. Mosquitoes breed in those kinds of locations. So making sure that you're emptying that water out so that mosquitoes can't breed in there is really important. Even if a mosquito has laid its eggs in there, if you empty out that water, as soon as those eggs dry out, they can't hatch. And so that will prevent you from getting bitten by mosquitoes in the first place, because we know that we all hate that. But do they bite or sting? I believe they call them mosquito bites, but I'm not sure. I would say that the mechanism of it is probably more like a sting, but that's a great question. And I'm not sure that I have the right answer to that. That might be more of an entomologist question. And then finally, as many of you mentioned, dusk and dawn. So we want to limit the amount of time we're outside when mosquitoes are most active, which we all know are during dusk and dawn when it's not too hot, it's not too cold, and the mosquitoes are just flitting about. So yeah, these are going to be your most effective ways to prevent mosquito bites or stings and potentially prevent West Nile virus as well.
Okay, thank you so much, Sining. That was a super helpful overview of potential communicable diseases. So thank you. And then Kyla is also part of our child health promotion team, and she helps to organize the free classes. She organizes and teaches free classes for childcare providers. So please email her. As you can see on the slide there, if you're interested in learning about how to create mealtime as more than food. or movement and learning in nature. And then our next Health ECE partner meeting will be Monday, November 18th. So put that on your calendars because it's the third Monday in November due to Veterans Day. Normally we're the second Monday of the month, but in November, we're the third Monday. And Amy is here, and I think she'd like to share something about ECCPC.
Yes, thank you. Hi, I'm Amy Carlo with the Early Childhood Council, Boulder County, and just wanted to share a few updates and some things coming up in the next few months. The first one is that we are really excited to be able to offer EQIT in Spanish. And we are currently just starting to prepare for that. The class is going to be on Wednesday evening, starting the beginning of October. I don't have the class dates confirmed yet, but just know that this is coming up in case you have teachers or know of anyone that would really prefer to take EQIT in Spanish. And the registration will be opening in early September on PDIS. We'll have more details coming out as things come together, but I just wanted to get the word out that that will be coming up, so you have that on your radar in case you know of anyone that might be interested in taking EQIT in Spanish. The second is that we are having a trauma responsive care for infants and toddlers in childcare course. That is going to be starting, it's going to be on Friday afternoons in October, the 4th, the 11th, the 18th, and the 20th. Oh, good. Martha has it up there. Those are the dates. We're hoping that these afternoons will make it a little more accessible for teachers or directors to be able to attend. And it's going to be virtual. I think I said that. And this flyer is hot off the press. So we're just starting to share that. So if you or any of your staff are interested, we'd love to have you join us. Susan Moore and Lorene Phillips will be facilitating along with support from our coaches, Tracy Youngdahl and Ursula Perez. So we're excited to have this, and we're hoping to be able to offer more courses on trauma responsive care in the future. And then, many of you may have heard, I think some of you came to our director's luncheon earlier this summer, and we announced there that we're going to be, our professional development committee is transforming into what we're calling the Early Childhood Workforce Development and Engagement Committee. And that is going to be, we're going to kick that off the beginning of September. And I'm going to be sending out information shortly to some that have already signed up for what the plan is going to be for this committee, because we really want to address the workforce issues and see how locally we can look at how it's affecting Boulder County and what we can do locally to support workforce recruitment and retention. And along with what the PD committee used to do also was we will continue to inform our professional development offerings. So please email me. I can put my email in the chat if you are interested in being on this committee, and I will send you more information. And then lastly, we are super excited, and here's another flyer that is hot off the press. There is going to be the first ever Northern Colorado Child Care Innovation Summit. Early Childhood Council Boulder County, we're partnering with both Larimer Early Childhood Council and the Weld County Early Childhood Council for this Child Care Summit on September 30th. It's going to be at the Longmont Museum from 9 to 3. And it's really going to be focused on solution focused and looking at with our business partners, with hopefully many providers that are able to come, and policy makers to come together and look at how childcare issue affects us all, and think about creative ways that we can address this in our community. Lisa Roy, from the Department of Early Childhood, is going to be there speaking. And so we think there's going to be a lot of opportunity to discuss together as a community. And there is the flyer. We'll also be sending that flyer out from ECCBC in other ways too. We just got the flyer the other day. So there's going to be lunch there, and we really hope that we can get as many of you to attend. And I think, as Martha mentioned in the beginning of this hour together, we really want to have those who are doing that work every day and supporting children and families. And your input here would be really important. So I think that's about it.
Perfect. Thank you, Amy. So many exciting things going on for people to participate in and improve and provide, just wonderful opportunities.
Thank you.
Thank you, Amy. And Jody, I believe another partner of ours, who's in charge of the Child Care Assistance Program.
Thanks. Yes, I'm Jody with the Child Care Assistance Program in Boulder County, and I'll just be really quick. I see our numbers are dropping here. We are getting ready to roll out our first of 3 rate increases to all contracted providers, so all providers who have a fiscal agreement. I put the link to the new rates, which providers who currently have fiscal agreements should have received information about those new rates, but I just threw those into the chat. And then there are, yes, Boulder County CCAP is still on a freeze, unfortunately. It's been really difficult to see a lot of families who need the support not get it right now. So we're making some really hard decisions this week about how to move forward for the next couple of years. So you will be seeing an update by the end of this week in the form of a memo, and as well as the provider news, which has been delayed as these decisions are being made. Thanks so much.
Hey, thank you so much, Jody. So for any of you that are still on the call, if you'd like to receive a professional development certificate, please email us with your first and last name and facility name to healthece@bouldercounty.gov. And then we're interested, our Health partner meetings are quarterly, and we would love your input of what your ideas are for future health partner topics and just what would be helpful for you. And we'd love to know, I think someone asked about HPAI, the last quarterly meeting, so that's why we focused on that for this meeting. So we really appreciate your input and want to make sure that these meetings are useful and helpful to you. So you can put any ideas in the chat, or you can email Sining and I at healthece@bouldercounty.gov. And then I just wanted to end. I wear 2 hats. I'm an epidemiologist and dietitian, and I'm part of the Association of State Public Health Nutritionists. And on a meeting last week, one dietitian who works in oversees all states, the CACFP program, Child and Adult Care Food Program, created this vegetable and fruit snack menu with cultural options. And Sining will put the link in the chat. And this dietitian said when they look at different ECE facilities, so often people are choosing some fruits and vegetables, but the goal is to increase more fruits and vegetables. So not just crackers and cheese, but always thinking, how could I have one fruit or one vegetable? And I really liked these snack menus, and I liked the second page, which is the cultural recipe options. So chickpeas and tomatoes and couscous. And if you click on the link that's seeming put in the chat, and then you click on a recipe, a tribal recipe, it will actually link it to the recipe. And it's just made for the different portion sizes that you might need for your facility. So I thought this was just a great resources. So to end here, I just want to say thank you so much for attending. Thank you for partnering with Boulder County. We appreciate all your input and just appreciate all the hard work that you do on a day-to-day basis. And I think we have a common goal, just to prevent the spread of disease, to keep classrooms open, and provide healthy spaces for children and teachers to learn and thrive. So does anyone have any questions or concerns? I'll stay on the line here.